Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Farah Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us. Welcome back. We have a very exciting show today. We have our three wonderful medical students, Payton Smith, Kathryn Haran, and Chandler Johnson, back with us. They are our year-long San Francisco Derm Society medical students who have made everything happen with us, in addition to being clinical research coordinators at the UCSF Clinical Research Center. But what we'd like to talk about today is their adventures in global health. And dermatology and global health is a very exciting world. Skincare dermatology means very different things around the globe. And really interesting trip that they just did was traveling to Kenya, which is what they're going to talk about today. So I'm so excited to have you three here. And
Thank
Payton,
you.
I'll start with you. Yeah, if you want to just give us a quick overview of what this trip was all about.
Yeah, thank you so much, Dr. Kamangar, for having us. Our trip to Eldoret was definitely a collaborative effort between UCSF Dermatology and MTRH Dermatology, or Moy Teaching and Referral Hospital. And so our primary aim was to share knowledge and resources that aren't yet available in that area to just enhance dermatology care and research.
Gosh, so great. And the wonderful thing is you have so many photos and great footage that I've seen. So hopefully over time we can share more of that as well, because just the visuals of what you guys did was so amazing. And I'd love to just hear a little bit more about what you guys did while you were out there. Katie, should we start with you, or Chandler? You guys let me know.
Yeah, sure. I can go first. I'd be
Sounds
happy to go
great. Thanks,
first.
Katie.
It was a really lovely experience. So we first flew into Nairobi and then we went up to Eldoret, which is where the Moy Teaching and Referral Hospital is located. And while we were at Moy Teaching Referral Hospital, I'll refer to it as MTRH. While we were at MTRH, we met with clinicians, phototherapy nurses, staff, other research team members, and even we met with hospital leadership. Like we sat with the interim CEO around this big table and discussed, kind of how dermatology can be improved at our MTRH and kind of what role UCSF can play in this partnership that we have established with MTRH. A big focus of ours while we were there, naturally, since our emphasis has been research this year, was kind of the research endeavors that they're beginning to start at MTRH. This includes a psoriasis registry that they are starting. It's collecting demographic and genetic information from patients that are being seen there at MTRH. And we're also working with them to help them develop a modified Geckerman protocol based off of the resources that they have there. They have, the phototherapy machine, and we're just, acting as kind of partners, a sounding board to kind of figure out how we can start that modified Geckerman therapy there. So that was our main focus while we were there.
That's so interesting. I know you guys were mentioning before to me as well that some patients have to travel really far, right? So that was the main impetus to maybe have some at-home therapies as well, rather than like how we do it here, where although not many sites even here do Geckerman, but when they do, it's you have to go into the center every single day.
Yeah, so that's why we are also trying to partner with the Living Room Hospital in Eldoret, which is a semi-private facility where we're hoping to get some patients admitted for medical treatment who especially live really far distances away, so that we can kind of explore providing day treatments at MTRH, like the phototherapy and the TAR, and then having a place for them to travel just right down the road so that they can stay in Eldoret while they're having this modified regimen done. And so we just want to ensure that patients have comprehensive care without overburdening either facility, either MTRH or living room. And so we're just considering setting up a memorandum of understanding between the two organizations to formalize this and exploring that partnership and hoping to grow together.
That's fantastic.
It's really exciting, the work that's being done now, and the journey doesn't stop here. The mutual collaboration is just going to continue on how it has in the past, too, because our trip to Kenya wasn't the first time personnel from UCSF have gone there. Dr. Liao has a really great, strong, long-standing relationship with the clinicians at MTRH, and I can just imagine those relationships growing over time. So there's a lot of work that we can continue to do together. And one of the things that we were discussing is the potential to even enhance that access to care in those rural areas of Kenya, maybe raising money to add an additional phototherapy machine, because right now MTRH is sort of the go-to site for that, but patients would still have to travel quite some way. So being able to have another phototherapy machine in a more rural setting, one of the outposts of MTRH, would be amazing for getting that treatment modality accessible to a lot of people that could benefit from it. And we firsthand saw amazing success stories, which made it a really gratifying trip. Just seeing some of the fruits of the labor of that relationship that has been fostered over time.
Yeah,
I think
absolutely.
that's such a good point,
Yeah.
Chandler.
Oh no,
Yeah,
sorry, go ahead,
so
Payton.
you mentioned that there's only two phototherapy units in all of Kenya, and one of those is private practice. So there's
Okay.
definitely a resource imbalance, and we hope that any kind of partnership in the future can kind of alleviate some of that imbalance.
Yeah, and I was going to add that, like you mentioned, Geckerman works really, really well. Like we don't do it as much here either, but I think Dr. Koo has a slide that he gives in his psoriasis talks, just comparing even all the new therapies and all the technologies. And then Geckerman is still one of the most effective therapies where you combine light, tar. I presume they're also kind of doing that protocol there, right? With like just the application of tar and added phototherapy.
Yes, we're working on getting crude coal tar, but at the moment they have linotard gel, so
Okay.
it has that aryl hydrocarbon component to it, as
Yeah.
Chandler so well knows. And so it's definitely a modified Geckerman regimen,
Okay.
but Dr. Liao is working with a pharmacist in Kenya, and I think we're going to be able to get crude coal tar from India shipped over, and so that will be a huge improvement to the protocol, we think.
That's incredible. This is such a large project that you've taken on because there's so many pieces, even down to just finding manufacturers and getting things sent and
Mhm.
shipped to the right places. So I could just imagine all the work that was done in the back end. And I would have actually loved to be in that room with the hospital CEO too, Katie, because just healthcare policy and running dermatology practices is, I think, so fascinating. So I would love to just kind of see the challenges that they have. A lot of the challenges we have now are things like our in-basket messages and access, but maybe a lot of that is shared too. So I feel like I would have loved to be like a fly on the wall in that room as well. And then just in general, I'd be super curious, what got you guys interested in global health and to set this up? And we can go in any order.
Yeah, I can start. So I had somewhat of an experiential curiosity through my study abroad program at Harding. So we studied abroad for 3 months in Zambia, and some of that included shadowing in the clinics there. And mostly I was shadowing clinical officers, which roughly translates to a PA here in the United States. So they didn't go through med school, but they have a significant amount of training and definitely provide a lot of really important care. And so I saw how important equitable healthcare access is in Zambia. And so as soon as Dr. Liao started telling me about the work that he had done in Kenya, I was like, oh man, what an incredible opportunity to learn how dermatology is done in Kenya, and also how we can maybe provide some assistance or knowledge sharing or resource sharing. So I wanted to be a part of that.
That's fantastic. Yeah. And Chandler or Katie? Chandler, we'll go to you next.
Sure. So I can honestly thank my mom for my interest in global health. So my mom is a nurse, and I grew up hearing stories of her time in nursing school. And one of her favorite experiences that really strengthened her fund of knowledge and really her skills as a medical professional was her trip that she had taken to Haiti when she was a nursing student. And they were providing care, and my mom's time there left quite an impact on her. She actually has lifelong friends from Haiti from her experience. And just hearing her stories was really inspiring to me and really piqued my interest. So, fast forward to college, one of my majors was Spanish, and I was pre med at the time too. So, I was interested in medical Spanish, of course. So, I had the opportunity to travel to Peru. And similar to Payton's experience, I did quite a bit of shadowing local clinicians there and seeing how medical care looks abroad as well. So that was sort of my first experience with global health. And then I returned back to Peru later on in college when my fund of knowledge was stronger when it came to my Spanish. So again, we were able to shadow, and my language skills had strengthened. So I really had a great experience learning more alongside those medical professionals that were practicing there. And I was really grateful for this opportunity to travel to an area of the world that I haven't traveled to before and learn more again how medical care is provided in a different hemisphere. So it's just a really cool experience. And I feel like I've learned quite a bit, and I'm excited to continue to be involved in some capacity in global health in my career.
That's fantastic. And Katie, any specific thing that got you interested in global dermatology or global health in general?
Yeah, well, this was actually kind of my first experience ever. I didn't have like a Zambia or study abroad experience, so this was my first time doing something like this. And I think a big part of it for me was just really strong mentorship from Dr. Liao. As Chandler mentioned, he's had this partnership established with MTRH for a long time. And, there was training with phototherapy nurses that were done at their previous visit. And I think having mentorship from someone who has had this partnership for so long and was kind of able to help guide me, at least through my first global health experience, was really meaningful. And, again, like Chandler and Payton, hopefully something that I can continue to have as a part of my future practice. And then, maybe someday in the future play a similar role in a student's life as Dr. Liao did with us.
That's fantastic. I was similar to you, Katie. I think my first experience with global health was also, she's starting in medical school, right around actually between that third or fourth year, what you guys are doing. That it was more with our like ENT and plastic surgery groups at UC Davis back then in medical school, where they did the cleft lip and palate surgeries. And then it was with Dr. Koo, the same fellowship you guys are doing now with Dr. Koo's group. During that, my clinical research year, we got the chance to go to Spain, but then also Taiwan to see how like different dermatology practices are done. Not to say that everybody who comes to do this clinical research year is going to be, having to also go and examine global health type settings in different areas. But I think if you're doing in this and the opportunity arises, just take that chance, because it's, like you say, it changes how you see medicine and how you practice medicine. And I think even now, as I'm kind of doing things like running your clinics and things like that, you've just seen a different way of doing it, because we can always, sometimes we get so stuck in the way we do certain things. So, and in that spirit, I'd love to actually hear from you guys, like if any like message, or if you have any, general guidelines or advice for any students, or not even necessarily students, even providers, anyone in healthcare who is interested in getting involved. Any suggestions for how to start, or whether to do it or not do it? So Katie, should we start with you? We'll go the other way. I'll start with you, Katie.
Yeah, of course. I think that kind of a big message to take away from this whole experience is that a lot of it is more about health access than traveling, internationally. I don't think that you need to travel internationally in order to be able to provide, good healthcare or kind of see a different side of things. A lot of people are doing a lot of really good work in their own communities, in their own backyard. One example community that was discussed at AAD was caring for the unhoused and kind of helping people who are in your community, who are in your backyard. And it's still kind of this different perspective of healthcare, but you don't have to go internationally. So I think that that's something that, if you're interested in global health or something like that, it's a really good starting point in how you can help your community here first as well.
My advice would be, you don't always have to travel around the world to have an impact on global health. So a lot of the future research with MTRH, now that we've established this partnership and these relationships, a lot of our future research will be data entry for the psoriasis registry, which we definitely need to talk more about. I can just go ahead and mention a little bit about it, but it'll be the first psoriasis registry in the continent of Africa. And so at MTRH, they don't have, data entry electronic records yet. And so until they're able to have that up and running, UCSF is happy to partner with them so that we can, collect that information through RedCap so that we can start, analyzing some of the data that we and MTRH collect about psoriasis patients in Kenya, so that we can understand, more about the etiology and the demographics about psoriasis in Kenya. And so we're happy to grow the partnership in that way, and it won't even require us to fly across the country just to have an impact on global health.
I think a final piece of information or a suggestion that I would have for medical students looking to get involved in global health is to seek out being involved in community efforts where you have a vested interest. So when we were at AAD, we heard an amazing lecture from a medical student who was involved in a global health project during medical school. And it was actually in a community where her extended family lived abroad. So she already had some insight into the needs in that community from information given to her from her own family. So I thought that was really cool hearing her perspective. But just to echo what Katie and Payton have been saying, initiatives don't necessarily have to be abroad. You can continue work here in the US and have a profound impact in some capacity. So I'm looking forward to the data entry component too, because we are RedCap experts after this research year. So I'm sure we're going to be helping out a little bit too.
That's fantastic. And I always learn so much from you guys because you're right. Like just thinking about back when we did it, you had to get on a plane and go somewhere because we didn't have all these virtual connections that we have now that seem so common. I mean, these were like literally we were like on the first iterations of the iPhone when we were going through these things, which was that was major technology back then. So you're right. It really actually, when you think about it, I'm even changing my mind literally as we're talking. I'm like, wow, that opens up so much possibility that I wasn't even necessarily thinking about because there's the one option, get on a plane, go somewhere. Maybe if it's procedural, you probably still have to do that because you have to go to a place and do the procedure. But if it's helping, if it's protocols, if it's data support, tech support, so much can be done. Actually, I wonder like what, and this is something I don't even know. Actually, I wonder if there are hubs forming within dermatology, you guys maybe might know more about this, where students can get involved with other centers like this. But I could chat to you guys after too. If we find any links or anything, we could always post it here as well. But it's, and just the whole world of shared research is changing so much nationally and internationally. Just research sites sharing genetic information, all of this information that then can be used in larger, broader ways is just fantastic. And you guys touched on it too, just for the health equity piece, so that when we do research, when we're looking at a clinical question, it's not on a very homogenous population. You have all these different data points that can be pulled from. So it's actually just incredible. I can only imagine, like I'm talking about when we were doing this, whatever years, 10 or 15 years ago, I can only imagine where these things will be in 10 to 15 years from now. So you guys will have to update us then as well. We'll check in 10 to 15 years as well. But it's very exciting. Just what you guys are describing is actually a major paradigm shift, I think, for people even in my generation or older. There are so many possibilities there. And just curious, actually, any favorite memories from the trip? Because you guys did do the component of actually traveling somewhere awesome as well. So any major memories from being there or anything that stands out?
So one of the very first experiences I had during my research year at UCSF was helping create the modified regimen with Dr. Liao. And so kind of that was the beginning of my research year. And at the end of my research year, we got to go to Kenya, and we actually got to meet the very first patient that went through this modified regimen, and just seeing I had seen several pictures of how horrible her erythrodermic psoriasis was, and the suffering that she was going through, and then being able to meet her in person and see how clear her skin was and how happy she was to be there. It was definitely something that I'll never forget. And I know I had a very small role in that, but knowing that if I was able to help in any capacity whatsoever, it made the whole research year just that much better.
Yeah, that's incredible.
Yeah, that was incredible. It really was incredible. I think that's the best word to describe it. That was one of my favorite memories too of Payton. Seeing that transformation was really unbelievable. Another one of my favorite experiences I had in Kenya was exploring the partnership with Living Room. So just to give you all some context about what I'm talking about is we were able to visit a site, a nonprofit site called Living Room International, run by a nurse practitioner who lives in Kenya. Her name's Julie Boyd. And she was just an incredible individual, so open and receptive to the idea of partnership, just with the concept in mind that she is trying to find any initiatives that will serve, the community in which she lives, where she's a part of. And she just really inspired me too. I think her experience, being a nurse practitioner from the States who moved to Kenya, it kind of pulled at my heartstrings because she did something similar to like what my mom did when she was a nurse in nursing school, which was go abroad, and she had visited Kenya, and she just found that she felt so at home there. So just seeing the work that she does in the community really inspired me. I was telling honestly anyone that would listen to me, like, I want to be Julie when I grow up. Like, she is just so inspiring, and I look forward to future collaboration between UCSF, MTRH, and Living Room, because I think that there's so much potential for growth there that would really serve patients living with dermatologic conditions in the community around Eldoret and even more rural communities. So that was really special. I could talk all day about Julie. She's amazing. We should drop links to her nonprofit too in the description.
Oh, absolutely. We'll include all of that. Any links you have for any of the cool adventures you guys had, the nonprofits, the groups, we'll include below. And Katie, any memories that come to mind?
I think Payton and Chandler have hit definitely some of my favorites as well. But I also think it was just, again, getting to spend time with all of the different members of the dermatology team at MTRH. As I mentioned, clinicians, nurses, research team members, phototherapy coordinators. And one night we had a big dinner at one of the therapy coordinators' houses. Her name's Isabel, and she was actually a former patient here at UCSF, and she had this big dinner party that she hosted at her house, and we were able to talk to people. We talked to a phototherapy nurse about her daughter who's living in the United States, and they were telling us about kind of what it was like there before the phototherapy kind of protocol was implemented, and how it's been ever since, and kind of their experiences as well. So it's just really nice to have that dinner and be able to kind of speak with everyone on the team about dermatology, but also personal life and that sort of stuff.
No, I agree with you, Kate. I mean, the things I remember too from like the trips we've gone are the people from everywhere you go, the physicians, the nurses, patients, even community members are so welcoming. Are they to, I think people usually respect physicians too. So when there's physicians and researchers, the communities I've been to are just so supportive. And then also they're so fun too. I think people just meeting different cultures. And so I totally can imagine what an amazing experience that would have been.
Yeah.
And hopefully you guys all kind of keep in touch with them as well. And that actually brings up my next question. You guys,
for sure.
yeah. So how did you guys kind of balance being somewhere so awesome where there's so much fun stuff to do and the work that you had to do as well? Because I think you were there for a very short amount of time to fit everything in. Did you guys get to just do a little bit of exploration?
We definitely did. I'm happy that you brought up Isabel, Katie, because the day after we had a party at her house, last night in Eldorado, we all as a team transitioned to the next phase of the trip, where we had a little bit of downtime. And it was my first time ever, being in Africa, and we really made the most of our time all together. So Dr. Liao had been on safaris before too, and so had Isabel before. So they were sort of priming us on what to expect in terms of taking smaller planes to the more remote area, where we went to a camp and spent time together, relaxing a little bit.
That's amazing. How
Yes,
about
I
you
was
guys?
so glad
Yeah.
that
Sorry, go ahead,
I was
Peyton.
so
Yep.
glad that Isabel got to she was able to go on the safari with us, and Isabel is one of the most kind and warm people you'll ever meet. By the end of the trip, she insisted that we all call her mom, and she still keep up and still email, and I can't wait to go back and see her and all of our friends again. But yeah, we got to go on a safari, and it was very funny watching all of us tried to hold on to the safari truck as as we were going up and down some of these really bumpy roads, and especially Katie and Chandler sitting in the back, just like getting thrown back and forth. So
I mean, full disclosure, my seatbelt was broken on the safari, so Katie and I would switch back and forth, just like, choose who's gonna have to hold on the hardest.
Oh my gosh, I love it.
But
That's
it's really
real
funny.
adventure. I hope we have some footage of
yeah.
that
Yeah.
because I know Peyton has sent a lot of good footage. So hopefully we can incorporate
Oh
that
yes,
scene.
yeah. We have so much footage.
We've got some really good photos too.
Oh my gosh, it's so fantastic. Yeah, seeing like speaking about it, I think doesn't do it justice because just seeing the visuals of it, like what an amazing trip, what amazing work you guys did. And of course, this being the Future of Dermatology podcast, we always have to ask about the future. The usual question we ask is kind of what you're excited about in the future as far as like things like global health and the topic we discussed, but it also would like to add to that anything that you think has changed in your career, in your future, kind of based on this experience. So maybe we'll go in order and you can answer any of those. What you're excited about in the future about global health or anything for your future that you think is different. Katie, should we start with you first?
Yeah, I think that, as I said, this was my first real experience kind of in the global health realm. And I think that it definitely made me realize and excited for a future where I can make global health a part of my own practice and my own career in the future, and kind of seeing, it's more important to have like a primary PI in the location who's leading the charge, and seeing what our role is more as partnership and supporters. I also feel like it was just like a really cool experience to again talk with people, people in Kenya who I've never been to Africa either. So that was a really cool experience to be able to see that. And I think it also kind of just helped me grow a lot as a person in terms of Payton, I think, has used the term a lot. I think a frequent word used in global health is like cultural humility. But Chandler and I went to an AAD lecture and they just talked about, that access to health, how you can kind of have cultural humility, and I still have a lot of room to grow, learning about it since this was my first trip, but that's definitely something that I'll take going forward.
I think that is so well said, Katie. I think those are great takeaways too. So for me, plans in the immediate future is I need to work with Isabel on growing her social media. If y'all know me here, I'm a big social media person when it comes to, first of all, Canva Blue, any advertisements, any website building. That's sort of like my passion project. So Isabel knows that about me. So she's really passionate about enhancing, the knowledge or the notoriety of phototherapy locally, and she wants to use social media to do that. And I think that's an amazing option of getting the word out there. So hopefully working with her to create some promotional social media posts and also just continuing to learn alongside each other about dermatology itself. So those are some of the immediate initiatives. And then going forward in my career, I definitely want to continue to learn and grow as a provider that has interest in global health, starting more local to my community, and then hopefully expanding outwards and seeing if I can mentor students, like I was mentored. So that's sort of just like the big picture for me for plans for the future.
Yeah, that's incredible, Chandler. And you bring up another really good point too, like social media. Of course, we talk about a lot of negatives of social media, but it has such a power to unite everyone and with education. So I'm always learning so much from you guys. Even back then when we went, social media was not a thing. I think like the first MySpace was popping up with like the guy, like Tom, he's your first friend on MySpace. That was like maybe the extent of what we had, or maybe not even then. That might have even been like a year or two after. So it's actually so incredible to think of the opportunities with just everybody being so connected now digitally. So, and you are amazing at social media. Like I feel like even when you're done with SF Derm this year, we're going to keep bugging you. Cause like, I feel like everything we do just has to get Chandler's eyes on it now. It's such a specific, amazing skill set that you have. And there's such a lack of like verified, important medical information on social media because there's so much other noise out there. So I'm actually really excited about just to see your career as a dermatologist and what you'll contribute to that world of just that, because it's your generation that knows a lot more. Like we're trying to do it, but we don't really get it. So I feel like I'm just so excited to see kind of what you end up doing in the next like few years as well. So, and Payton, lastly, it's last but not least, what are you excited about for the future?
So I am really excited to hopefully one day be a part of Glowderm. So one of my mentors, Alexis Strahan, is heavily involved in Glowderm, and I think they do an amazing job of sustainably advancing skin health in resource limited communities. And so I want to hopefully be a part of their mentorship program. If anyone wants to search, just Google Glowderm, Glowderm. Glowderm, they have an amazing mentorship program, and something that they talk a lot about that I'm very excited about for the future is having a mentee. And so I've had amazing mentors, Dr. Kiprono and Dr. Liao, and Glowderm really emphasizes the fact that when you have a mentee and that relationship, you are really multiplying your efforts. And so it's not just you going out into the field and seeing patients. You have, you're also exponentially growing your impact, because you're seeing patients, but then also the people that you train see patients. And so if you're not having that education and that relationship, I think it's a huge loss. And so I hopefully will one day train mentees, and we can all be involved in global health, and whether it be through clinical care or research or advocacy. I'm just looking forward to whatever we can accomplish together.
That's amazing, Payton. And I can't wait to see just the three of you, the amazing year you're going to have back on clinical rotations, then application cycle, and just a few short years, and you'll be out as dermatology attendings. So I'm so excited to see for all the impact that the three of you are going to make, because you're much smarter than we were even back then. So it's just amazing to see what you guys are doing. So thank you, all three of you, so much. And I can't wait to kind of put some of the images to this too at some point. And whenever that's available, we'll also share it on our YouTube page. And of course, at the SF Derm event, we're going to be in July, we're going to be showing lots of clips of all the amazing things you guys have done. So thank you so much.
Thank you.
Thank you.
Thank you for letting us share this really impactful experience, Farah.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.